Treatment options for valve disease depend on which valve is affected and how it's affected, whether the valve fails to open or fails to close. With respect to the aortic valve, if the valve fails to open, what's called aortic stenosis, then treatment should be performed as soon as the patient becomes symptomatic, for sure, and maybe a little bit beforehand if the echocardiogram is grossly abnormal, because there is such a thing called sudden death that occurs with aortic valve disease, which is a sudden onset of ventricular fibrillation that occurs out of the blue, and these are unrecoverable. But most people are somewhat symptomatic with shortness of breath with aortic stenosis before treatment is initiated. And that treatment typically is aortic valve replacement, ideally through a minimally invasive approach. If they're elderly, have comorbidities, severe COPD, previous strokes, grossly debilitated from some other disease process, then maybe a non-surgical therapy would be appropriate. But typically surgical therapy is the best option. With aortic insufficiency, that is the valve not closing properly, the treatment is always aortic valve replacement. When people become symptomatic or when the heart begins to not beat as strongly as it should under exercise, even if the patient's asymptomatic, that valve should be replaced.
So once you start getting symptomatic, you start to deteriorate. And that's why I said symptoms start shortness of breath, chest pain. Once you get those symptoms, your days are limited. Typically with shortness of breath, by definition, after 2.5 years, you start to really deteriorate. You can't wait till the last minute because your heart really starts to fail and you start going into congestive heart failure. And once you get to that stage, sometimes you're not a candidate for surgery because your heart's too weak. And if you are, a lot of your heart function doesn't return. As Dr. Purut was saying, so you want to get it done early. But once you start having symptoms, chest pain's about 1.5 years.
Yeah, so I think
your lifespan.
Right. I think an easy way of thinking about it is that in anyone with aortic stenosis, the average lifespan from the onset of symptoms is less than 5 years. So without treatment, you can expect to live no more than 5 years. With treatment, your lifespan is determined by all the things that determine any of our lifespans, not your heart.